Good evening. Welcome to the Board of Health meeting. It is now 6:30, and today is November 24th. 5:30. Wow. 5:30. I'm rushing through. It's 5:30 and it's November 24th. At least I have the November right. So, okay, I'd like to call the meeting to order and review the agenda and add or remove any items.
Yes, Ray, I would like to change the approval of minutes. 7/14/14, actually, we already approved those.
Mhm.
And I actually want to put in 8/25/14. So
Okay.
it'd be two sets of minutes, 8/25/14 and 9/8/14. please.
Okay, and we want to move that to the end of the meeting?
Sure, please.
Okay. All right. Next item, do we have a bill schedule?
Yes, sir.
All right.
So on the bill schedule, you're going to notice the nursing staff, nursing staff for the flu clinics.
Yep.
Oh, yeah.
Okay.
Okay. So, it's Cheryl, and Pamela?
Cheryl, Pam,
And Margaret.
Margaret from the schools.
Okay.
Yeah, the first one is Cheryl's monthly for being the public health nurse, and the other is from the
I
clinics.
helped out.
Okay. And Miha, which class was that?
That is the update for emerging regulations.
I'll see you there. I'll be there too.
I missed the MHOA, so.
Yep. Okay. Any question? Oh, there's a second. What's this one?
The truck stickers.
Oh,
are in
okay.
there as well from Creative.
All right. Oh, that's just separate here. I'm looking at, there was two things. Cheryl's thing was on a separate one too.
Oh, yeah, she submits a monthly
Mon-
invoice
so-
and then the other one.
okay.
Yep.
All right. Any questions or concerns? Do I have a motion to accept?
I make that motion to accept.
Second the motion. How do you vote?
Aye.
Aye.
Thank you.
Okay, bill schedule. All right, so we can go right into correspondence under director's issues.
Sure. So in your packet, you actually have the yearly Mass Department of Public Health, the cancer registry. So they send that out once a year, usually this time, to inform each of the cities and towns with a cancer incident registry. So you have that in your packet. I'm sure if you look on the page listing Auburn, it gives us the breakdown.
Okay.
If you go all the way to the back area.
Blind.
So on that, that's again the report from the state. What they do is they compile all of the results for different types of cancers, such as cervix cancer, colorectal, larynx, leukemia, all different types of cancers, and they categorize how many through male and female. That count is put together in a report and provided to each town. Basically, it gives you a baseline of where you're at. And if you look at this yearly, you get to see if anything upticks in any certain area to bring focus to that. So what I plan on doing is at least looking at the ones in the past, just to see if there's anything that's different.
Anything else on the, on this?
For correspondence, I think that is pretty much the only thing that we actually got in from the state. I can. Is it okay?
Just
Okay.
move right down the list.
I'm going to move right down to emergency response update on Mass Department of Public Health Ebola planning.
Okay.
As you may know, the state continues to have weekly conference calls on the Ebola front. This week, actually, because it's a short week, they are actually going to postpone it till next week. They gave us an update last week, as they do each week. Eileen and I both participate in the calls. They're both or one or the other, whoever happens to be in the office. They have pretty much gone across the gamut for first responders, police, paramedics, hospitals. It's really been a really proactive approach across all agencies that would come in contact with.
So are you
Ebola.
getting those conference calls?
Yes, ma'am.
Can we get into those conference calls?
You absolutely can call in on
So
those.
you can tell me how to do that?
Sure. Yep,
Okay,
can
I
send
think
those
I
out.
remember.
Yep, I send them out, and we can certainly, we can tell you over the phone if the email account.
Yeah, I have an email.
Sure.
Yeah.
Yep, I can send that out for you by email.
Okay, and then, so how would I get into that then?
So basically, they
I would
have
like to hear it at the same time.
Yep, they have a conference number that you can
I
call
okay.
into. Yep.
Oh, now I remember.
Sure.
Oh, all right.
Yep. So they've been very helpful, and so I just wanted to let you know that those continue to happen.
That's great.
And then next week they'll resume on a weekly schedule. Emergency preparedness, I wanted to let you know that in your packet you have a memorandum of understanding, an MOU, that's updated for the school, the use of the high school for the EDS. The last one that we had signed was quite a few years ago. So we're in the process of going through and updating all of our documents. So this was one of the big ones. Our Region 2 Emergency Planner, it's right here. Region 2 Emergency Planner has been meeting with us pretty regularly. And we did a walkthrough of the high school to assess the best areas that we could use for emergency dispensing site if we had to move a large number of people through. So I think we identified a kind of a good space to keep everybody indoors, out of the elements, whether it be hot or cold, and to have enough area to be able to register large groups of people, move them through, and get them inoculated or administered meds. So we have a plan in place for that. He is working on giving us basically a written breakdown of the plan. So that is something that we're tweaking a little bit from years past. So we'll continue to provide the updates as we get them. Okay, so you'll notice kind of I want to try to bring you the documents.
The he that you talked about, Ken Gigas?
Yes.
Thank you.
Also on the HAN, a couple months back, I had asked if all the board members were on the HAN so that you can receive any emergency messaging that comes out through the HAN. The HAN stands for the Health and Homeland Alert Network.
I used to be. So how would I get back on that?
So that's why I wanted to bring it up again. Ray, I know you regularly
Through work,
see
yeah.
those, yeah. And I know Steve had expressed some interest in getting on, and he had hit sort of a roadblock. So I've gone on and I've spoken with some of our state contacts, and they have a limited capacity for how many people that can be on the HAN. What I want to do is make sure that all of our board members can be on. So whatever they need to do to move things around, I think it's important that you are informed in case of an emergency. Obviously, it's imperative that any one of us, if for some reason we can't be available, that there's backup for all of us. So I think it's a good idea to make sure that all three board members are receiving those alerts. Paul is on, myself, Eileen, Ray, and my intention is to get both you and Steve on as well. So we can give you instruction on how to do that.
Great.
Solid waste, I wanted to give you an update. The solid waste advisory is meeting and continues to meet typically monthly to discuss the upcoming trash contract for the new year, for the end of fiscal year. So that's going to be June 30th. So we are looking at you know, the items that we need to update for the new contract, and I just wanted to bring that to your attention. We also...
And that's the one with Republic?
Allied Republic.
Allied Republic,
Yeah,
that's, okay.
Republic Services. I also wanted to let you know that we have been part of the Wheelabrator discussion, and they had some recent negotiations to be able to negotiate some of the contract terms and some realized savings that are going to be apparent. That there's been some recent activity with some meetings as of last week, and we are going to hopefully see within this week a new
contract.
draft, right, some draft changes on the disposal contract.
Who has
So-
to sign that? Is that DPW through us, or is that us?
No, that's actually going to, that would go for town administration.
That's town administration,
Yeah,
okay.
with obviously the Board of Selectmen
Mm-hmm.
oversight. So that is going to be happening. I will let you know when that draft contract comes through. But
Okay.
right now, we're paying approximately 74 and change per ton at the Wheelabrator, and that savings is going to go down considerably starting with the January 1st. So I wanted to bring that to your attention. We also have as you saw in the bill schedule, we have the truck stickers that were ordered and received. So we do have those in, and I'm going to be scheduling probably a couple of days early within the next 2 weeks for the truck stickers down at the DPW. So that's typically the day we'll pick a couple of days, different times where the trash haulers and septic haulers can come down. We can sticker the trucks and get them on their way. We try to, make it as easy as possible so they don't, getting a sticker doesn't interrupt their business too much. So I just wanted to bring that to your attention. It's going to happen probably in the first or second week in December. We'll probably do maybe one of each.
You did one in the morning and one in the
Yeah,
afternoon last year.
I like to break it up so that way.
They
it's-
like that.
Yeah, if it's easy for one, maybe it's easy for another. For the tobacco update, there's actually no update at this time. The animals, I just wanted to let you know that the position that was advertised, we are in the process of interviews, and we are hoping to be able to get further along in that process and be able to make a decision with town administration. The Mass Department of Public Health, the arbovirus, we continue to receive the reports on cleaning culverts and taking down vegetation. The testing for mosquitoes has subsided. The Abandoned Housing Initiative, we have been working with the AG's office, as you know, on several properties in town. We have been making a lot of headway on that front, and we continue to work with the AG's office to be able to try to get the title searches done, to be able to identify the responsible party. We've had a lot of help from the public in sending out the letters. Sometimes the responsible party isn't the party that's always apparent. So to be able to have the help from the AG to identify the responsible party, sometimes people just don't even realize that they've owned the property and they live out of state. They don't know the condition that it has gone into. So we've had several houses that we've been able to bring back into compliance, and we have several that we're working on currently. The prescription take-back program, I am happy to report, we just did a disposal on this past Friday, and we had three big buckets that we brought over to Wheelabrator. It came out to be 110 quarts of medication. So it was, I needed help just to get the buckets too. So we were able to go over there. I thank the Auburn Police for accompanying me to the Wheelabrator. Sergeant John Kelleher was a great help in getting the drugs disposed, and of course Wheelabrator for accepting those drugs. So 110 quarts is quite a lot of medications. And I want to say this is our either third or fourth disposal this year. So the program is working very, very well. As you remember, we got a grant from the Chamber of Commerce, Auburn Chamber of Commerce. So,
Quick question on that.
Yes.
The new owners of Wheelabrator, are they gonna stick with the plan that we have with them, that they've been doing it for us, or?
I don't have any reason to believe that
They
they
wouldn't.
wouldn't.
Okay.
Yeah, they, I think they're being purchased, so it's
It's
different
keeping the
name.
management,
Right.
but they're just changing the top. I just want to make
Exactly.
sure,
Yeah.
because we have a good deal going with them, and
Right.
I'd hate to see somebody come in and say, oh yeah, we're not doing that anymore, then us try to have to figure out what we're gonna do with it.
Yeah,
so.
there's been
Okay, good.
no indication from me going to Wheelabrator stating that there's going to be anything different.
Okay, good.
And certainly that was a partnership that was created earlier this
Good.
year. I can't imagine that, they
No, they
would
would-
want something different.
Okay.
So office administration update, I wanted to let you know we've had some busy trainings in the past month or so. The staff was offered customer service training through Human Resources. So we had some training for different times, staggered times, so that everybody in the office could attend customer service training. We had Mass Department of Public Health come out. Their dental hygienists did some training for the fluoride program that we have in the schools. Every 5 years is a required training for the nursing staff that administer the program. It was very informative. Eileen and I were allowed to participate with the school nurses, and they were very, very helpful. They were able to answer questions and go through the process. I know a lot of the school nurses do it. They know it. They probably can do it in their sleep, but it was nice for for them to oblige Eileen and I to attend. So they have a great program going on there, and they continue with that program year after year. The ALICE training this past week, we actually had a very involved training. Last Monday and this past Friday, we did a training to help prepare us for any threat that would come into the town hall. So that was very informative. Both the police department and fire department worked collectively to be able to train all of the
Very good.
yeah,
Very
train
good.
all of the staff here, and it didn't matter what level you were at. They took the time to be able to break it down and answer questions. It was excellent. And finally, there was MAHB, Mass Association of Health Boards. There was a Saturday training this past Saturday that Marion, myself, and Eileen were able to attend. I think, Steve, you had gone a week or two ago, and I thought the training was wonderful. We had kind of a gamut of all topics, and I find it's always current. They always try to pick something that you're dealing with currently, but it's usually a brush up on things that maybe you don't see every day, and they kind of talk about the general laws that we have to enforce, maybe some obscure laws that we think we know a lot about, and then they bring up something new. So we always seem to learn something new, and this
It's true.
this one wasn't any exception. So we've had a lot of trainings in the past couple of weeks, and it's a good time of year to try to fit those in. I know about a month or so ago was MHOA, so it was nice to piggyback on that. So that's the update on pretty much what's going on in the office. Any questions on any of those?
Not yet.
No? Okay. So for inspections, we've been extremely busy with nuisance complaints and vacant properties, trash complaints, so in housing complaints. So I know Eileen has been busy on that front. I'm gonna actually let her provide an update on that and where we're at with some of the food items.
Okay.
We have about 6 weeks left towards the end of the year, so we're trying to finish up all our required inspections. Lots of complaints, so we are handling them. We have a couple temporary food events that are coming up. Two, most notably, the Holiday Craft Fair that's over at the school. We have about 10 food vendors at that. And then we have the Christmas tree lighting. Holiday Craft Fair is December 13th, Christmas tree lighting December 5th. And we have, we had talked, do have 2 new establishments that are in the works. X-Golf is in the process of a build-out. We anticipate that we'll be hearing from them soon. And then we have had 2 people come in to reopen the BPs. One on Washington Street and the one on Route 20 across from Halligan's. The one on Route 20 across from Halligan's is actually in the process. I've been out, inspected it. They have a couple more things to do. And the Washington Street one is just in the beginning stages.
Excuse me, what kind of thing are they gonna open?
They're the old BP gas or existing BP gas stations.
Oh, I
They
see.
all closed earlier this year and one in late 13. And they've been vacant probably for about 6 months, and they're going to reopen now under new ownership. So,
Same owner for all of them, or the different
No,
owners?
different.
Okay.
different owners. And there were 3, 2 have approached us for reopening, not the 3rd yet. So, we're going through that. And based on the time that they were closed, Steve, they do have to go through the whole process again, including other departments like planning for site plan.
Once you have a new owner, you can start requesting everything. That's the
Yeah.
good thing with that is, even if some place, like even a little place down the street said, oh, somebody's buying my store tomorrow, it stops right there. New owner opens up the whole code, which I
Right.
love about that, because then you can say, oh, they were grandfathered in on that 3-bay sink. Well, now they're gonna have a 3-bay. So
And that's why I
yeah.
why I went out there and did a quick inspection, because I hadn't been in there
Yeah.
before we started with them.
that's good.
And then Jack's Variety. We had talked last month about getting an update from Jack to see where he was. Just to update you, August 22nd they signed the MOU that
Okay.
the board had approved,
Yep.
allowing them to contain their drip tray in a
Yep.
container and bring it down next door to Heritage to be washed and bring it back. The system that they set up was they bought 2 food-safe containers, 2 drip trays. At the end of the day, they take one, drop it down there, put a brand new one on, so they don't have to concern themselves with getting it washed and getting it right back. So the next day when they go down with their dirty one, they take the clean one back. That's working for them. I did a site visit today. He had, one of the agreements when you had made it with him was that in 3 to 4 months, he would let us know where he was heading with this. So I went and did a site visit. It looks great. It was clean, orderly. The drip tray was clean. It had been used, so you can see that. I did ask him where, what his intention was for the sink. And he actually was hoping that he could come back in front of the board in December and talk to you about the process he has now and keeping this process. So I did tell him that I would bring that back to you, and that, if he wanted to speak about the process he has now, he would be the one that could best explain to you how it fits into his business. And then I could certainly let you know what I observed when I went there.
So would you like to put that on for the December meeting?
If that's when we can meet with him, if the first one we have set up for right now, it's not in stone, but December 8th, If we want to put him on for that meeting, I would say put him on that meeting. Send him a letter or whatever, and invite him to the meeting if he wants to go over it. Whether or not we vote on that day, we may take some time. It all depends on what everybody wants to go over, and get a good look at the code. And a couple other ideas I had after that meeting have come up, but since we haven't talked about it with him, I didn't want to bring anything up without him being here. I mean, we can discuss it ourselves, but there's other ways we can handle that too, not just the 1 or 2 bay sink or whatever we required of him. So yeah, if the members don't have an issue, I'd say I would put him on for the first meeting in December.
Okay, great. I did tell him that I would notify him tomorrow
Yeah.
of what date.
Yeah, because it was supposed to be a temporary fix.
Yes.
I don't believe it should be a permanent fix because it's not. We allowed it. It's not really a great thing. So we wanted him to get open and get his coffee in there and earn some money so he could earn enough money to put a sink in. And I just want to make sure we're still on the same page as that.
I will let him know and invite him to the December 8th meeting.
Yeah.
Okay.
If we could have all the prior documentation, correspondence
Yep.
in our package beforehand.
Mhm.
Thank you.
Absolutely.
And what was that meeting again? The date of that
I
meeting?
thought you said the 8th.
December 8th
No, the meeting that he was here for. Do you remember
Oh.
when that was? That was in
20th.
July.
of July.
If we could pull the minutes from that one, just so we have exactly what we said.
Mhm.
There was also a subsequent meeting.
Subsequent
when we
meeting, so any
voted
meeting-
on-
Yeah.
Any meeting that we had information on him, I'd like to get at least the minutes out for those, so we can take a look at those. Yeah, though I thought one of them was from today too, in our new packet. So, okay. So I'm just gonna rip that one off to the side, and it's actually on the 811. You and I were here together, so it's on the front of that page. So I'll keep that one to the side too. Okay. Anything else under inspections?
No? Do you have any questions?
I do not, but at this time, Steve, if you don't mind reviewing the approval of minutes, the two sets of minutes we have, you and I were the only members there,
Mhm.
so you and I are the only ones that can vote.
Okay.
Communicable disease? Yeah,
Sure.
that way
Yep,
Marion can
absolutely.
start on that.
So we have the report. This one is 12.
Yeah.
No, I have nothing to do. I gave them both something to do, and I have nothing.
Did you read through these?
I read through them already. Everything looked, everything was good to go on my point. I didn't see any issues.
Can I make
no
a single
omissions.
motion? Or should
I
make
think
two
you have to.
separate?
I think we have to do separate motions because
Okay.
they're two separate dates.
I'll make a motion to accept the meeting, Board of Health minutes from meeting 8/25/14.
I second the motion. How do you vote?
Aye.
Aye.
I shall also make a motion to accept the meeting minutes as presented for the Board of Health meeting of September 8th, 2014, as presented.
I second the motion.
Aye.
Aye. Okay. So, Marion,
You wanna look at it?
I'm gonna give it to Steve
Yeah.
because he likes to look at that. Any other questions or concerns? Anything general you have on the communicable disease? Any general questions or concerns on that?
No, not
Okay.
at all. I'm a pretty healthy town.
You have questions?
Needs
I mean, the only question,
Means nothing
not,
to me.
it's more of a professional curiosity, is that one case on the front page.
Yeah, I see that myself.
Was it the D68 or is it?
Yeah. Where, I would be interested to know where that was, or was it
Yeah.
in the town, or?
I
Yeah.
can get clarification from the.
Yeah, I mean, we don't
healthcare
need any, we just kind of
Yeah.
more from a professional curiosity standpoint.
Sure.
Okay, at this time, just open up the meeting to any members' comments, questions or concerns. kind of a quick meeting tonight. Is there anything out there outstanding that you want clarification on?
Nothing.
We're gonna have, December 8th is the
That's
next meeting.
That's next. I'm not done. All right, since there's no more member comments or anything, any questions or concerns, we can step into next meeting schedule. Our next meeting right now is scheduled for the 8th of December. If at all possible, I'd like to be able to hit that one and maybe table the one that's the week of Christmas.
Yeah.
I don't feel, there hasn't been anything really big going on that I think we need to have, but if something does come up, we can always get a phone call and do a quick meeting if we have something that's pressing.
There's another week, there's the 15th before the,
Yeah, so if something comes up that's pressing that we have to get in, then we have to get a voting meeting in. If it's not a voting meeting, we don't really need to have one. Unless there's something that really big comes up that you think is pressing for us.
5:30, working for everyone.
5:30 works for me.
Really works for me.
Okay, so we'll go with the 8th.
The 8th at
Okay.
5:30, and if you want to, if we can put Jack on for like 5:45, keep him, I don't want, that way if the meeting's running quick, we're not waiting or anything, we can do him to the beginning of the meeting and get him over and done. How are, I knew I had a question. Have we been sending out permits yet for the end of the year?
Yeah, I'm glad you asked for that.
And I had that on my list.
Yeah.
Okay.
We did a new database,
Okay.
which, with a mail merge,
Mhm.
and we're just completing the letters. So me and Paula should, I should go over how the mail merge works with Paula tomorrow, and they should go out
Okay.
tomorrow night,
And what do they do by?
December 12th.
They're due to have everything in by December
We
12th?
gave them a little more than 2 weeks.
Okay.
I mean, certainly, they can call
Yep.
if they're corporate, they need to wait for time for a
Okay,
check.
that's fine.
But I just think that the longer you give them, the more it sits in
It
the,
sits
oh, I
in the-
can do
yeah.
that later pile.
That's great. When do we start with the late fees? Or when do they late? December 31st, or are we December 12th they're late and the fees start, or you're
December 31st.
first? Okay.
Yeah, because their permit, I mean, technically is
Go,
good
it's good till the
31st.
31st.
So honestly,
But it's
as
nice
long as
setting
they-
that
yeah.
date so they can try and get it in early, get you
Right.
time to get your paperwork out, which is great. When do we start the fees? 30, after the 31st?
Yeah, so
Okay.
if, in the past, what we've done is, as long as the, so if somebody doesn't have it in by the mid-December,
Mhm.
okay, but they have it in by the 31st, or it's postmarked by the 31st, we actually use that as a guidance
Yep.
for last year, and I think it worked really well.
Good.
So if by chance, because the 31st is always, New Year's Eve,
Mhm.
it's, sometimes we have, we're out, say maybe a little bit earlier on that
Yep.
day. I don't know, I can't remember which day they do that, but
Yep.
if for some reason there's bad weather or there's a closure of some sort earlier, as long as the postmark, so this, Paula actually saves the envelopes, saves the postmark, and as long as they postmark by the 31st, we don't charge the late fee.
Good.
As you remember earlier this year, we dealt with a lot of late fees.
Yep.
And we had a lot of hearings in the first couple of months. I don't anticipate that that's going to continue. I think this year, Eileen has spent a lot of time with Paula, and both of them have worked hard to get the renewal process more streamlined, and by using the database that Eileen's kind of set up,
Yep.
I think it'll make it a little bit easier to process too.
Good.
So she's done a lot of work on that front, and I think working together they'll be able to handle those processes a lot easier. So we'll try it this way. If we have to tweak it again, we'll do that.
I mean, the way I look at it, if you have them due by December 12th, but we're not going to charge a late fee till you've given them 30 days. Even though you said, yeah, I'm giving them 2 weeks, you give them 30 days. They have plenty of time to get it in.
Right.
I've always been, if it's late, you pay a fee. You're late for any other bill, they make you pay a fee. The restaurants, they're collecting money every day. All the businesses that have food permit, they're collecting money every day. It's not like, people, oh, well, I didn't have any catering jobs this month, so I have no money. There's money coming in every day. They can pay their fee, pay it, and get it done. And I've always been of the fact, if they're late, they pay a fee, they can come in front of me all they want, they're paying a fee. I mean, we have paperwork we have to do, we have to get it done by a certain time, we need to get everything out, and if they're holding us up, it costs us time and money, they can pay the fee. So. Any other questions or concerns?
No. Fine.
Do I have a motion?
I make that motion.
What motion are you making?
To accept the minutes. I mean, accept all,
Close the meeting.
yes, and close the meeting.
I'll second.
And second, how do you vote? Aye.
Aye.
Good evening. Have a good night.